A recent large-scale prospective analysis has revealed a deeply concerning association between advanced liver fibrosis and a sharply increased risk of stroke and early death, even in individuals without any previous cardiovascular disease. The study, based on data from nearly 380,000 middle-aged adults in the UK Biobank, challenges long-standing assumptions in clinical practice. It suggests that we may be grossly underestimating the broader systemic impact of liver dysfunction, particularly subclinical liver fibrosis, which has traditionally been overlooked in the absence of overt liver disease symptoms or cardiac risk profiles. What makes this data so alarming is the apparent independence of this risk from traditional cardiovascular conditions, such as coronary artery disease or previous stroke history. Participants had no known stroke events or coronary heart disease at baseline. Yet, among those identified with the FIB, 4 score greater than 2.67, an indicator of advanced liver fibrosis, the incidence of cerebrovascular events was significantly higher across the board. These individuals had nearly double the risk of ischemic stroke, and in some cases, over triple the risk of hemorrhagic strokes like intracerebral and subarachnoid bleeding. This suggests that liver fibrosis operates as a silent but powerful driver of systemic vascular damage, insidiously increasing the likelihood of devastating cerebrovascular events in people who might otherwise be considered low risk. Notably, the hazard ratio for stroke-related mortality was more than 2.2, and overall mortality was 2.59. When analyzed using an alternative fibrosis marker, the APRI score, the association remained grimly consistent, a 3-fold increase in total mortality and a more than 4-fold increase in the risk of intracerebral hemorrhage. This data should trigger a fundamental reassessment of how liver health is monitored and managed in general populations. The focus of preventive medicine has long been anchored in cardiac risk profiling, cholesterol, blood pressure, diabetes. But liver health, particularly fibrosis without overt cirrhosis or fatty liver disease, is rarely flagged unless it escalates to critical dysfunction. This neglect now appears dangerously short-sighted. Moreover, this study paints a darker picture of how insidiously liver pathology can undermine vascular health. The liver is often described as the body's chemical processing plant, but its dysfunction appears to ripple outward into the vascular system, affecting blood clotting, inflammatory response, and metabolic control. The correlation between fibrosis and hemorrhagic stroke may reflect a breakdown in hemostatic balance, something that clinicians may not be screening for until it is far too late. Perhaps most troubling is the implication that this elevated risk is not only undetected but unprevented. Because liver fibrosis can progress quietly, without pain or visible symptoms, and because its markers are still not part of routine health checks in much of the developed world, millions may be walking around with a ticking time bomb in their abdomen, completely unaware. Public health systems are also failing to keep pace. Despite the availability of non-invasive tools like the FIB, 4 and APRI scores, which could be incorporated easily into standard health evaluations, most healthcare providers do not systematically assess liver fibrosis unless there's clear clinical justification. And even then, treatment options and guidelines for subclinical fibrosis remain fragmented or non-existent. There's also a disturbing irony in the fact that liver fibrosis, a condition closely linked to preventable lifestyle factors such as alcohol use, obesity, and poor diet, is now emerging as a leading hidden driver of strokes, another major cause of disability and death worldwide. We are seeing the long-term consequences of years of underinvestment in preventive public health campaigns, poor dietary regulation, and weak intervention strategies for substance abuse and metabolic syndrome. In the face of this new evidence, it is not just time to reconsider liver fibrosis as a secondary concern. It must be reframed as a primary warning sign, one that indicates severe and likely accelerating systemic dysfunction. Ignoring it could mean missing the early chance to prevent a fatal or permanently disabling stroke in a patient who otherwise shows no warning signs. Clinicians, policymakers, and patients alike must be warned. Liver fibrosis, even in its quieter stages, is not just a liver problem. It is a whole-body threat. It is a signal of a deteriorating internal environment, one that could claim lives through the back door of neurological catastrophe. Unless systemic changes are made in how we detect, track, and treat liver damage in its early stages, we are inviting a future with more strokes, more premature deaths, and more suffering, all of it preventable.